we're not catering to our children's preferences, but we're actually creating them. If we can get those first 1,000 days to be firm and sturdy and stable, we have a much better chance at success later on in life. We don't like this whole sort of concept of baby foods and toddler foods and kid foods and then parents eat separately. Starting as an early introduction of really having whole foods and focusing on family foods is really important. As parents, it's our responsibility to decide what we feed our kids, when and where. But it's their responsibility to decide if at all and how much. So if we're providing nutrient-dense foods that we know have the correct fuel sources for our baby to grow and thrive, that's more important than having really varied diets.
Hello and welcome to smulcast, where we help you and your family live a healthier and fuller life. I'm your host, Dr. Tracy Flowers. Does feeding your kids feel like a bit of a power struggle? Peas pushed to the side, broccoli met with dramatic gags, and endless negotiations about, can you just have one more bite? You're not alone. In today's episode, we'll be chatting about how to raise happy, confident eaters. With expert advice and real-world tips, we'll help you take the stress out of mealtimes and possibly even make them fun. To guide us, we're joined by Dr. Jess Smith, an integrative paediatric GP and mum of two who's helped hundreds of families rebuild food confidence. Jess, it's so lovely to have you here today. I'm so excited for this topic. Can you tell us a little bit about who you are and what you do?
Thank you, Trace. So exactly as you said, I'm Jess, Dr. Jess to my little kids, but really just Jess, and I'm an integrative pediatric GP, which is kind of a long-winded way of just saying that I take a very integrative and holistic approach to healthcare, digging a little bit deeper and looking more for root cause medicine as opposed to just symptomatology. And a huge portion of this is obviously coming down to nutrition. And so I have a really big passion for nutrition, and that interleads into all the different systems of the body that I'm interested in, like gut health and immunological health. And so, yeah, those are just parts of my passion. I'm also really passionate, though, about teaching parents and also teaching the kids. And I find that this is a much more empowering way to allow parents and the children to actually address their own healthcare issues. As you said, I'm also a mum of two, so I'm actually on this journey alongside most of my patients and their parents. I have a 5-year-old daughter, almost 5, and a 3-year-old son.
Jess, I think you're the perfect person to guide us through this topic today, and it's such a meaty one that we're going to get stuck into. When we were preparing, we decided purposefully to avoid the topic or the label of picky eating and rather focus on nurturing healthy, happy eaters. Can you talk to that a little bit more for us?
Yes, I think language is a really powerful thing, especially when it comes to our children. Every day I see a lot of patients who particularly come with a concern of their child's nutrition or picky eating, as parents will label their kids. And I just find that negative connotation unhelpful, firstly, because it often creates a sense of blame on the child, which really doesn't actually empower that kid to want to have a more healthy relationship with food. It's got layers of shame attached to it, which I think is just really unhelpful. And kids really pick up on these types of things. Also, most of the time, the sort of picky eaters that I see is not actually due to some kind of organic underlying pathological process happening. Of course, those do exist, but the vast majority are not because of a type of gastrointestinal disorder, reflux. They could have allergies, they could have sensory oral aversions. Those are actually the rarity of these cases, and the vast majority are actually just children who haven't had the correct learning about how to have a healthy, happy relationship with food, and potentially parents have done some of the wrong things along that journey. So I don't feel it's particularly helpful to call them picky eaters. I think it's much more helpful to teach parents from an early stage how to nurture a happy, healthy relationship with food and drive the kind of focus that way.
I think it's such a useful reframe for us as parents. Can you talk to us about the importance of nurturing a happy, healthy eater?
Yes, I think it's really the foundation and the cornerstone for health in general. We know that we call it the first 1,000 days of life as sort of our foundational years. And if you were to think of a great big building, right? You have to have a solid, firm well-structured foundation for the building to be beautiful and thrive. And I think our bodies work in exactly that same way. And if we can nurture those first 1,000 days, not just from a food perspective, but from a neurological perspective and immunological perspective, if we can get those first 1,000 days to be firm and sturdy and stable, we have a much better chance at success later on in life. So really, the importance of creating that sense of relationship with food is that it is lifelong. And those effects that we have in those early days have lifelong consequence. I think, for Tracy, you would know this more than I, you work with adults, but so much of an adult's gut health is completely begun and has stabilized pretty much by 3 years old. So those first 3 years are really foundational. It's not also just about creating a sense of, fuel as food and nourishing our bodies, but also creating a positive relationship with food so that these children can have a good intuitive sense of our food relationship. We want them to be happy eaters as well as healthy eaters.
I think you've touched on some really useful insights on why it's important, but I can kind of see where that's going. Can you talk to us about some of the risks of maybe not raising our children as happy eaters?
Yeah, and I think, I like to call it happy, healthy eaters, but those are two distinct things, right? So as a healthy eater, of course, we want to focus on teaching our children how to eat a lot of sort of nutrient-dense food. So when we sort of think of healthy foods, healthy isn't only eating, a very set, structured way. It's about having good diversity, good, variety in the foods that we eat, but also nutrient density, which is important. We see food as a fuel for our bodies, right? And we want to fuel all of our systems appropriately. But happy is important too. That's the other side of it, because we never want to create a negative relationship with food. And this can be on either extreme end. A picky eater who only wants to eat 5 different foods or excludes particular food groups is concerning, but a child who eats perfectly and is afraid of sugar is also a problem, not just in childhood, but actually ongoing. So, we talk about a variety of different types of eating disorders that can be present from early adolescence. And, we're talking there really from 10, 11 years old that we're seeing this in children who are either not wanting to eat at all and completely cutting these food groups, or who are what we call orthorexic and really structured in particular and linked with anxiety around food. And that's obviously not what we want either. So healthy and happy are two separate things that intertwine, and it's really important to kind of meet both those sides. The downfall to obviously not creating that is that from the healthy perspective, if we're not introducing the right fuels into our body, our system is not going to function appropriately. So if we wanted to think of a child's body, or an adult's body for that matter, in the different systems and what each of those systems particularly requires, especially for a child where we're not just functioning, but we're actually growing, we're developing, it's much more complex than just an adult. So we've got to make sure that all the correct fuels are going in to service and kind of allow those functions to be happening in a smooth, rhythmical way, and that there's no deficits along that way. From the other perspective, we also want to make sure that we're nourishing a healthy gut microbiome, which really, especially in those first 3 years of life, is pretty rapidly developing. And by 3, it's kind of set and sort of resembles what the adult microbiome will be. And that has lifelong effects. We know that an unhealthy microbiome, a low diversity of microbiome, an unstable microbiome, we talk about dysbiosis, that has many consequences on all the different areas of our body and all the different systems of our body. So we want to make sure the right nutrients are going in so we don't have deficits there. But also we want our children to be able to have good outward kind of behavior, emotions, regulation of all of that is important too. If we're not fueling those systems appropriately, then our children are not going to be happy, they're not going to be well regulated, they're going to struggle to learn. So it's not just about growth and development, but also actually thriving. We want our kids to not just kind of survive, we want them to thrive.
Jess, I think that's such a balanced perspective and so useful to think about. I am thinking as a parent here myself and wondering how our relationship with food as parents influences our children's relationship with food.
Enormously. So I think this is also somewhat a generational thing. So as millennials, we're all kind of grouped in there at the moment, and we sort of grew through an age of serious diet culture, a desire to always be skinny at the detriment of health, and that comes through with us beliefs that we have, and our beliefs around food and our own relationship with food will come through in the way that we talk about food, in the way that we provide food, in the types of food that we're offering. And I think that that's really important because, like anything in parenting, actually our own experience comes through in the way in which we raise our children. And if we want our kids to have positive relationships with food, we have to make sure that we are not kind of bringing along our own kind of traumas from our generational learning. And it's not at all to say that every millennial's had a negative relationship with food, but it certainly is much higher than generations that have kind of come after us. So I think it is really, really important. The way we talk about food and the way we act around food is huge. One of the sort of first questions actually that I'll always ask parents when I see them for picky eating kids is, how many meals a week do you eat with your child? And that seems like a strange question to ask, right? Maybe for me it's strange because it's so intentional for me. I have to be very intentional about eating together as a family with my children because life is busy. But sometimes parents will literally say to me, oh, we'll have breakfast together on Saturday. One meal in the course of 21 plus meals over the week. And I think what's so important for us to remember about our kids is that they do what we do, they don't do what we say. So if we want our children to have a healthy relationship with food, they actually have to observe us doing that same thing. And so often I say to parents when I see them at 4 to 6 months before their babies are starting food, and we talk a lot about that, I always say to them, actually starting your baby on solids is a good way to get you to have a healthier relationship with food in yourself, because you're going to have to start offering your kid all these healthy, nutritious foods, and it's actually a great way to kind of clean up your own diet and have a better relationship with it yourself. I think the problem also kind of leads into, just this sort of society that we're living in now. Life is busy. Most parents are working parents. We have a lot of pressure. We have a lot of, just a lack of time, I suppose, for these types of things. And for cooking, the idea of cooking family meals might feel a little bit daunting for parents who don't have time. I mean, I'm there, I know it. It's not convenient. And the problem with that is that sort of this kind of drive towards convenient foods and so on typically ends up being highly processed foods. And again, that's not necessarily creating a healthy relationship with food, but also part of kids' sort of curiosity around food and curiosity to play with food is also what builds their healthy relationship with food. So you don't want your kids to kind of be sitting in the other room while you quickly throw something together. You kind of want them to be sitting there watching you prep the food. They are far more likely to actually eat if they've been a part of the process of creating that food. So I think, there's the convenience perspective of it. There's the pressures that we feel. In 2025, it's also tricky because we almost have an excess of information available online, and it can be quite tricky to discern whether or not it's truth or whether it's misinformation. And sometimes we'll hear something that will make us completely convinced of that, and then another thing that's completely contrary to that. So I think for parents in this day and age, it's actually really difficult, and there's so much pressure to do the right thing, and it can be difficult to know what that is. So it's tricky. I think our relationship with food in and of ourselves has huge influence on our children because they just are going to do what we do.
It's so helpful for us to be mindful of that as parents, and that we're invested in this conversation in another way, not just for our kids, but for ourselves as well. And possibly even, as you touched on earlier, for generations, and how our relationship with food impacts how other generations may do that. Jess, we've talked about the importance and we've talked about the risks of not raising our kids as happy, healthy eaters. But it would be really useful if we could run through maybe what that practically looks like in terms of children's developmental stages. We know that there are various developmental stages for kids. And so I'm thinking that what a happy, healthy eater looks like might vary from age to age. Can you talk us through that timeline?
Absolutely. So if we sort of think initially, I always like to sort of put it down to our foundational years as our kind of cornerstone. And that obviously starts not just actually at birth, but during the pregnancy. So although we're talking about our children being happy, healthy eaters, it's influenced by the maternal health prior to the baby being born. So a mum who, for example, has difficulty with her metabolic health, if she's obese, if she has diabetes, that sort of thing prior to pregnancy is actually going to affect the baby as well. So it's really important to make sure that those are well managed prior. The maternal microbiome and the paternal microbiome will affect the development of the baby's microbiome as they're born. So we want to try and always, in the same way that we always say to moms, 3 months prior to conceiving, you should be taking supplements, you should make sure that you're nutritiously healthy, etc. We should actually also be focusing on metabolic and microbiome health in those 3 months at least before pregnancy. Then obviously during the pregnancy it matters too, the types of food that mom is eating. Does mom have any nutrient deficiencies during her pregnancy? Because that's going to influence the way in which baby grows. So a big one there, for example, would be iron. So iron deficiency is a huge problem. The stats worldwide of childhood iron deficiency are incredibly high, not just in South Africa or African countries or sort of our developing world, but in the developed world, iron deficiency is astronomically high. And it actually starts from pregnancy. In the 3rd trimester of mom's pregnancy, all of those iron stores will cross the placenta and go through to baby. And then those stores need to last for baby from 4 to 6 months before they start eating foods. But if mom began as deficient, there's going to be an insufficient transfer across the placenta, and then baby starts off with insufficient levels of iron. And so we have to consider the nutrient kind of relationship that mom has with food during her pregnancy, and that obviously can be tricky. We don't all feel well when we're pregnant, but it's so important to make sure that we're getting the nutrients required for your baby's brain growth and overall development. Then, of course, when baby is actually born, we really, really, really want to advocate for breastfeeding. Of course, formula feeding is there as we need it, but breast milk is really perfectly designed for human growth, development, and thriving. And there are things in breast milk that we just don't unfortunately get through formula milk, although there are some brands now who are adding things like HMOs, which are human milk oligosaccharides. Those are sort of these really wonderful things in breast milk, these types of carbohydrates that particularly feed bifidobacteria, which is one of our sort of favored bacteria in the gut. Some of the formula brands nowadays have managed to synthesize some and are adding it. So that's really, really cool. But yeah, the way in which we feed our baby in the beginning, 4 to 6 months, we really try and advocate for breast milk as far as possible. Then, of course, it comes into the realms of sort of our later infancy, where we're talking about weaning and we're talking about introduction of solid foods. And how we do that is so important. So if we sort of think there's kind of key periods in your baby's life where there's opportunity for big influence. Birth and breastfeeding in those early days is obviously one of them, the mode of delivery, and then the type of milk baby's receiving. And then starting of solids is another really profound opportunity for us to start feeding the correct bacteria in the gut and so on, which influences our appetites and influences the development of allergies and atopy and all these types of things. So doing that correctly in those beginning days is really important. And I think sort of practically how we do that really matters. There's a lot of belief systems here that sometimes get in the way. So I've created this PDF for all my patients that I give at this age. Actually, I wrote the PDF for my mom because I wanted her to see that, just because we did things like this, 35 years ago, doesn't actually mean that we still want to do that today. I always say to my mom, we know differently, so we do differently now. Never say better because then they get a bit defensive, but we do differently because we know differently now. And so the approach that we take with solids, we really want to focus as far as possible on whole foods. And we also want to actually focus on the types of foods that the family eats, because we really quickly want to get that baby onto family food. We don't like this whole sort of concept of baby foods and toddler foods and kid foods and then parents eat separately, because again, that disparity of not doing what I do creates issues. So starting as an early introduction of really having whole foods and focusing on family foods is really important. And then I kind of like to, I think this is helpful for all ages, but I like to classify food into 3 different categories. We have plant-based foods, we have animal-based foods, and we have processed foods. Plant-based foods would not necessarily mean a processed vegan burger, but that would be processed. But plant foods, we eat them how they grow. So fruits and vegetables, nuts, seeds, legumes. I think of plants as the body's cleansers. So it's fiber, which is literally cleaning out our guts and feeding our microbiome. It's vitamins and minerals, which are helping those cells to function. It's polyphenols and antioxidants, which is literally cleaning up our DNA and getting rid of toxins through the body. So really, really an important category, right? But plant foods don't have a lot of calories in the beginning, and babies don't really take in big volumes. That's when we come to the next category, which is our animal foods. Animal foods are the body's builders. And this is so important for a growing, building little person, right? In our first year of life, your baby is literally going to triple in size. Their brain volume doubles in a year. It's a really incredible, rapid growth sort of period. So we want to make sure that we're getting a lot of the right calories in and all the right ingredients. Builders are important, and that would sort of be, full fat dairy, eggs, meat, chicken, fish. These are important not only because all animal products are what we call complete proteins. All the essential amino acids are coming through from every kind of animal product, and that's important because we're growing, brain cells and brain connections. We're myelinating those brain connections, which requires amino acids. It also requires iron, but we're also building bones and muscles and skin and hair and all of these things. So we need complete proteins for that. One of the sort of other features of animal products that's really important is our omega-3 fats. So we've specifically got DHA and EPA that comes through our animal foods, and those are really crucial for the development of your baby's brain and actually even their vision. So, and there's clear studies on this. Children who are low in DHA during pregnancy, breastfeeding and beyond have visual issues and brain development issues. So it's really important to get those fats in. Unfortunately, we don't get DHA and EPA from plant-based foods. So while we get amazing other healthy fats from our plant foods, absolutely, we predominantly, the omega-3 that we get sort of from chia seeds and flax seeds and those types of things is ALA. And humans are just not really good at converting that. At best, an ALA to DHA conversion is between 4 and 8%.
Okay, really low.
Very low. So, you've got almost none of it is converting. And when you have such a high requirement of DHA and EPA, you want to give it in the most easily bioavailable form. Same thing with iron. We do absolutely get iron from plant foods, but in smaller volumes and not in a well-absorbed bioavailable form. So heme-based iron from animal products is much easier utilized by the system and much better absorbed. So we want to focus a lot on those builder foods. And then kind of everything else is a processed food, right? And for me, processed foods are about fiber and fun. So obviously in the early days, not the fun, right? So the first 24 months, we really want to restrict the chocolates and the chips and the sweets and so on. Not to say that those can't form a part of a healthy diet, but definitely later on, we don't want any of that under 24 months. But the other side of it is our grains, so quinoa and sourdough, our breads, our pastas, our cereals. And for those, I kind of use the fiber content as your sort of discerning factor as to whether or not you're going to include it or not for your baby. So I kind of teach parents how to read food labels, and I think it's an important skill to learn and develop. There's always those 2 columns per 100 gram per serving. Per 100 gram column, you want your fiber content to be at least 6 grams per fiber. And then it's a yes food, and then we can liberally give it.
Great.
But it's also about balance, right? So I always say to parents, always have a builder, always have a cleanser. If you choose your processed food, that's cool, but add your builder and your cleanser. So if you're going to have some oat porridge, add in a bit of yogurt, add in some peanut butter or some fruit for your cleanser. So just to kind of create that balance. And I think thinking about food in those 3 areas is helpful actually for all ages, because when you've got a little baby that you're mixing up some purees with, when you have a toddler who's having little meals that are kind of more solid and more parent-like or more adult-like, or when you are building a lunchbox for your kid who's going off to school, you want to kind of think of, am I sort of ticking all those 3 boxes?
Such a useful framework to have in mind, and I think it's quite easy to remember.
Yeah.
So I'm going to definitely use that tip, so thank you. Jess, you touched on some of those age categories. So you mentioned that early phase where we are breastfeeding and then when we are starting to introduce foods. Can you chat through those different age stages and maybe give us an overview of what we would expect a happy, healthy eater to behave like, or what we would anticipate in each of those stages, and maybe also what's just developmentally normal?
Yes. So I think the first thing is if we're getting ready to start solids, we can start solids anywhere between 4 and 6 months old. But for me, what's far more important than the baby's chronological age is their signs of developmental readiness. And we need all 4 signs to be met before we start. And I think this is important because if we start solids too early, and signs of readiness have not been met, we're actually going to create a negative association with food for that baby. So we absolutely never, never, never at any stage, not babyhood, toddlerhood, childhood, or adulthood for that matter, we never force feed anybody because it will create a negative association. So if your baby hasn't got their 4 signs of readiness, which is sitting with minimal support, bringing their own hands to their mouth liberally like this, they need that sort of hand-eye coordination. It's losing their tongue thrust reflex, which can be checked for by anybody, any doctor that you visit. And then lastly, interest. We actually want to see that your baby is interested in food and that they're reaching for food that you're eating and they're observing you when you eat and they're showing signs of interest. If we've got all of those ready, then your baby is going to have a much happier journey with food. And then what we always like to say is, this is actually sort of a dietetics principle that I've borrowed, but we talk about the division of responsibility when it comes to food. And again, relevant for all ages and stages. But as parents, it's our responsibility to decide what we feed our kids, when and where. But it's their responsibility to decide if at all and how much. So if your baby at 6 months is opening their mouth, eager for food, grabbing everything and getting mushy and messy with it, they're interested and they're eager, right? And then we go along with them and we kind of go with their pace. But if they're closing their mouth, turning their face, they're not showing signs of readiness yet, it is important for us to back off. It's not to say you're not going to try again, but you're going to give them a little bit more time and then try again later. So I think that can be quite normal. So sort of 4 to 6 months, not all babies are actually interested yet. So it's important to look for that. From sort of 6 months plus, most babies love food and they're very curious and they're very excited to try different flavors and textures and have fun with their food. And so it's quite important actually to follow our baby's lead there. And this is where we don't like doing old school kind of when everyone just had plain rice porridge cereal because it's a low allergy risk food. So it was considered safe and it's fortified with iron. But it's completely bland and boring and very smooth. So it doesn't actually challenge a baby's sense of different variety and flavors, and it certainly doesn't challenge their texture. So we want to introduce a good variety of all of that. Of course, every baby's got a different temperament and some are more kind of explorative than others, but we want to actually challenge them. So most babies during that period are pretty keen on challenging and trying all different types of flavors and textures and having fun with their food. A classic developmental thing happens sort of between 12 and 15 months, where most parents get really worried because their little baby was demolishing food and super keen and interested, and now suddenly they stop or lose interest in food and kind of reduce the volumes that they've been taking. And this is completely normal. We expect this. So sort of 12 to 15 months, most babies, they actually reduce their caloric needs. So again, iron, for example, the iron requirements from 6 to 12 months is 12 milligrams a day. From 12 months plus, it drops to 8. So our nutritional requirements are actually reducing because remember, we tripled in size in that first year of life. Now we slow down quite a bit. So everyone always worries, oh, we're not gaining so much, but it slows down completely in that second year of life. So they actually don't need quite as many calories as they did as babies. And so if we're also still taking too much milk, for example, so lots of 12-month-olds are still drinking a lot of milk, whether it's breast or formula, that's going to completely displace their appetite for food. So we anticipate a little drop there. So that again is something that always at 12 months old, I kind of warn parents about and say, expect that, it is going to come down and it's okay. It's still our responsibility to decide what we're offering, when and where. And it's still their responsibility to decide if and how much. So we have to respect that. Then we kind of go through the classic toddler period, which is kind of from 1 to 3. And that can be tumultuous from a very normal developmental period. So something that's always, I find this so interesting, babies and then toddlers even more so have about 10,000 taste buds. We only have about 2,000 or 3,000. If you're very lucky, I think like connoisseurs and stuff perhaps have about 4,000. So they have 2 to 3 times the amount of taste buds that we have. And this was sort of evolutionarily protective because as soon as they're physically able to wander off and go find some poisonous berries, nature made it so that they would actually be averse to that. So that increased number of taste buds makes them a lot more sort of sensitive to flavors. So the mild bitterness of broccoli to you or I could be overpoweringly bitter to a toddler. So it does make them a little bit more averse, and then they tend to want to have sort of our bland foods or our beige foods. What's important here is to not let them stick to that. So we're still going to put the broccoli on the plate. We're still going to offer it. You might put something tastier on it. You might mix it with some cream cheese or make it, like a little bit more palatable for them perhaps, but you're still going to keep offering it, anticipating that it's normal for toddlers to not love vegetables. They often prefer fruit because sweet is, in our brain, considered safe. So that's very normal. And this kind of happens for the period of about 12 to 36 months. And I think what's important there is also just to normalize it and know that it's not our children being naughty. They're not just being combative. They're not behaving. It's not a behavioral issue. They're not behaving poorly. It's actually just developmentally normal. They do sort of start coming out of that after 3 years old, where they do start kind of being a little bit more wider, I suppose, with the types of things that they're willing to try and being a little bit more curious with the types of things they'll eat. So we always see after 3 it does kind of settle if our foundation has been right. So if we've fallen into the trap of then only offering the bland beige foods consistently, that becomes what they know, and then that becomes what they only want. So I sort of think another powerful thing to always remember is those first 3 years of life, we're not catering to our children's preferences, but we're actually creating them. And that, I think, is an important thing to remember for parents, because if we consistently give the backup of the beige food, they just learn, oh, if I don't eat the veggies, she's going to give me a bowl of yogurt. Okay, not to say that it's bad to have some yogurt here and there, but we can't eat that 3 times a day, right? So that, from a developmental perspective, is also normal. And these sort of ebbs and flows are also very normal. I say to parents, don't think about what your toddler eats in a day. Think about what they eat over the course of a week. So, we were talking just before the show about how my son and your daughter last night had nothing to eat, right? They're 3 and they didn't want to eat anything. And that's okay. But my son had a great lunch. So that kind of ebbs and flows. We don't have to get them to kind of fit the structure of what we think is ideal, or certainly not the structure of what we as adults do, because little people are not small adults. They're completely different. So we've got to treat them differently to the way that we expect from our adult perspective.
Jess, I think that was so reassuring, especially being a parent myself, but I'm sure to other parents as well, to know what is normal, especially in that toddler 1 to 3 age category. I'm now thinking, are there any signs of concern that we should be looking out for in those various age stages?
Definitely. So, although we're talking about picky eating from non-organic causes, there are definitely organic sort of underlying pathological processes that can affect the way that our babies, toddlers, children eat. So if we kind of take it back to the beginning, think of a baby, right? In the early days, we should have a baby who cries. It is normal to cry, but crying should never be inconsolable. So I always say to parents, it's kind of one of 5 things. They're hungry, they're tired, they're cold, they're uncomfortable, or they just need a cuddle. If you're troubleshooting through those 5 things, but still your baby is crying and crying and crying, that we call inconsolable crying. And that usually, with a small baby, makes us concerned about the gastrointestinal tract. Human beings are kind of really immature in the beginning. And if we think about the anatomy of the gastrointestinal tract, it's actually pretty complex. So if we eat and drink, we don't think at all about our food. They actually say once it's gone 1/3 of the way down your esophagus, it's completely out of your awareness. But that's not the case for a baby. When they're born, they firstly for 9 months have not had to use their gastrointestinal tract whatsoever. On top of that, their gastrointestinal tract is mostly sterile, meaning there's no microbiome yet, which means there's no communication network yet between the way that the brain and the gut are communicating. So not only now do they have to learn how to breathe, they then have to learn how to suck, swallow, breathe. They then have to learn how to start digesting and breaking up that milk in the tummy into different ingredients. They then have to open one valve, close the other so it can let it go out. They then have to contract their little intestines through in a rhythmical manner while it's absorbing nutrients. Then back at the colon to kind of draw fluid back, again, be rhythmical in its motion. And then right at the bottom, we have 2 anal sphincter muscles which have to coordinate simultaneously and open at the same time to pass wind or poo, which is really difficult when we have no communication network between the brain and the gut. And so in those early days, there is a level of gastrointestinal discomfort that is completely normal for small babies, but not to the point where it's affecting their ability to feed or it's affecting their ability to stool or making their crying what we call inconsolable. I don't really like the definition of the word colic, but we think of sort of colicky babies as the definition is really a baby who will cry for more than 3 hours a day, for more than 3 days in a row, and we don't know why. For me, it's a little bit of a slippery slope to just say that. We should absolutely be looking for reasons why before we just name a baby colicky. But if you have a baby who is crying a lot and they're inconsolable and feeds don't seem to soothe your baby, if feeding is an uncomfortable place to be, then we worry that potentially your baby is experiencing pathological reflux. We also obviously want to look at the poos. So if your baby is having nice, regular, soft yellow poos, we're happy. But if they're starting to look mucousy or bloody, that's definitely a concern. And then we worry about potentially having some underlying allergies. Commonly things like cow's milk protein allergy can present that way in those early couple of weeks of life. But really our baby should be consolable if they're crying, feeding well. If we're having difficulty with the latch, we can be concerned about oral ties, which can affect breastfeeding, but also eating solids later on. So those are all important things to kind of look for in your babyhood time. You know, in those first 6 months of life, also most parents are going for quite regular visits to the clinic. And one thing that often brings a sense of sort of stress for parents are the growth charts. So in South Africa, we use the World Health Organization charts. In the States, they're using CDC charts, which are slightly different. But basically what that chart is showing us is an average. So if we basically took, for the World Health Organization charts, we took populations of kids in all the different continents around the world. And we said, if you were all born on the same day, separate girls and boys, and you were breastfed, how much would you weigh? And then we plotted it on a chart. So those charts are very linear, but growth is not linear. Growth will sort of be this kind of up and down, little roller coaster, as long as the trend over time is appropriately going up. So what we kind of want to see within those first 6 months is about a 20 to 30 gram per day growth, and it needs to be along their trend. So if your baby started on the median, on the 50%, we want to kind of see that they hang around there. If your baby started on the 10th centile and is smaller than most other babies, that's totally fine as long as they're growing on their trend. And that's often something that, you know, parents will be worried about that because unfortunately it's color coordinated. I wish it wasn't, because the median is green and then as it goes orange and red, which kind of makes us feel like, oh, danger, we shouldn't be there. But as long as they're growing along their trend, we're happy. Of course, a cause for concern would be if that's starting to plateau at any point, if we're crossing down along lines, or if we're calculating that weight over a certain period of time and it's not kind of fitting in with our 20 to 30 grams per day, then that would be a concern and we would need to flag that. We also want symmetrical growth, right? So we don't only weigh our babies, we also measure their length and we measure their head circumference, which is an indication of brain growth. So we want to see that their growth is symmetrical. So sometimes what we'll see is maybe they grow a little bit taller, faster, and their weight's a little bit lower behind, and then it catches up. But over a kind of 6 month period, we want to see that they're all sort of tracking quite symmetrically. That's important too. Then if we sort of think of older age, so when we're starting solids, so sort of 4 to 6 months plus, we need to see that babies are interested in food. When babies cross that 6 month threshold and they're really disinterested in food, they're very slow to uptake on their solids. We sort of by about an 8 month mark want our babies to be eating 3 solid meals per day, or at least being offered that. How much is still up to them. We just want to see that they're eager to try. And if we have a baby who's really averse to trying, then we start worrying about underlying things like potentially reflux still. So at that age, we can sometimes have a surge in reflux. And, you know, for anyone listening who's ever experienced heartburn or reflux, it's awful. The last thing you want to do is eat. So if our babies have been experiencing that, they're going to be disinterested in food and they're going to rather want to just drink milk. So a disinterest in solids at that age would be concerning. A big one, again, you know, we focused on the poos in babyhood when we're only on milk, but when we're starting solids, it can actually be a bit of a constipating time. learning how to digest all these nutrients and different sources of nutrients from solid foods can be hard on the gut. So, we sort of want to actively prevent constipation when we start solids, but it certainly can happen. So focusing on your baby's poos is really important. If they're starting to slow down too much and skip days, or if those stools are really hard, often we talk about the little nuggets, that's definitely going to affect their appetite and going to make them unhappy with food. Part of starting solids in those early days, not only is it about the sensory experience and the introduction of textures and flavors and fun, but it's also about the introduction of allergens. And so if we're triggering on an allergy or an allergenic food is creating a reaction in a baby, that's definitely going to be a cause for concern. So when we're sort of introducing our allergens, I always explain to parents that you're looking at skin, at tummy, and at breathing. And you want to look for early and late signs of reaction on all three of those things before we progress. So anything like that would be obviously a cause for concern if we're seeing reactions to foods. And then as we sort of cross later on, not necessarily a cause for huge concern, but if they are 12 months plus and they start reducing it, it's just to be aware of their milk intake. Not necessarily that that's a pathology in a baby, but if they're drinking too much milk, they are going to reduce their food intake. And after a year, definitely food needs to be prioritized over milk. So just to kind of be aware of that. And then again, as they go through, so important to just keep monitoring those poos, monitoring the comfort around food, especially as our children get older. Once they're 2 years and plus, they are able to communicate more. And so I actually had a little 2.5-year-old patient the other day who is verbalizing to their mom that every time they eat yogurt, their tummy gets sore. And that's important because I do feel that we need to listen to our kids when they're able to communicate with us. I think sometimes we kind of, they're just saying that because they don't want to go to school or whatever. But kids don't lie. So it is important to listen to them. That also helps to let them listen to their own bodies, right? We want to have that intuitive sense of what's happening. So often I'll see children who you ask the parent about the food and then you ask the child about the food and they actually have different stories. Same thing with the poos. You ask the parent, you ask the child will tell you something different. So kind of monitoring their comfort around food is important too. One thing I didn't touch on that I think is actually also important in the sort of 6 to 12 month period is textures. So if you have a baby who's really averse to textures and seems to gag on everything, is bringing everything up, that's a bit of a concern because it might mean that they haven't appropriately desensitized their palates. The gag reflex is present for all babies and it's particularly quite strong between 6 and 8 months. And that's kind of a window of opportunity for us to actually work on desensitizing that gag reflex. So that's why we actually really like a baby-led weaning approach where we're offering babies finger foods because that helps them to actually in a safe way desensitize that gag reflex and then it starts moving back on the palate. So we all have a gag reflex, but it should be quite far back, not forward in the mouth. If it is too forward, it's going to trigger baby to bring food up all the time, which is not a very nice sensory experience for a baby. What we sometimes see is if we have a parent who's really worried about choking and so on, and they actually avoid textured foods, and we get to sort of maybe 10 or 11, 12 months old and this baby's only been on really smooth runny purees, we've kind of lost that window of opportunity, and then that baby's gag reflex is going to be more profound and it's going to be more difficult to actually kind of integrate it a little bit further back. So that can be a cause for concern if you feel that your baby's gag reflex is kind of overstimulated. We want to see that it's shifting back. A cause for concern, I'd say, for our older kids is really about cutting major food groups. So we want our kids to get a variety of our builders, our cleansers, and our fibers, but we also want to make sure that they are not cutting big things. So your child might have a preference of carbohydrates, for example, but as long as they're still eating proteins, that's good. They might not like Brussels sprouts, but they're cool with sweet potatoes, so that's okay. We just don't want them to be completely removing food groups because that's problematic. So we need to see that they're willing to take a little bit of everything. And then another cause for concern, which often parents don't actually realize is so interlinked with food and nutrition and eating, the actual skill of eating, is the way we breathe. So our airway health is really interlinked with our ability to eat and have a healthy a sort of happy relationship with food. I don't know if you've ever had a cold and your nose is blocked. How difficult is it to eat, right? You sort of take a bite, have to breathe through your mouth. So if your child's got any upper airway issues, and in toddlerhood, this is common. You know, when we go to school and we get constant snotty noses, we can have our adenoids get enlarged, we can have allergies that are inflaming our little noses, we can have middle ear infections, any kind of upper respiratory infections that go ongoing can have an effect on the way that we eat and the way that we are breathing and eating and how we do those things together. This is also commonly why when kids are sick, they stop eating, right? They intuitively know, oh, let me just leave this for now. And that's another, I suppose, developmental normal thing, a normal pattern is that they don't eat when they're sick. So assessing the way that your child actually can breathe really matters on the way that they can eat.
We'll touch back on airway just now, because I know when we were preparing, you were talking about the role that food actually plays in our airway development, and that's fascinating as well. But I'm wondering, Jess, if a parent does pick up one of these signs for concern or a number of them, I think so many parents nowadays, and I've done this myself as well, even as a doctor, we go online. That's where we go to for information and reassurance, potentially, but sometimes we get the other end of the spectrum and it becomes quite anxiety provoking. If someone does see any of these signs in their children, what should they do?
So I think, again, we kind of spoke on this already, but it can be really tricky when we're going online because there is such an overload of information, which I think can really be quite fear-mongering for parents. So I've had so many parents who come and they're convinced that their child is allergic to dairy, and they really aren't, because they've just read so much about how dairy is the worst thing ever, which it isn't. And for some kids, they might be allergic, then sure, yes. So I think what is important, yes, to do your own research and to sort of investigate and kind of learn about things on your own accord, but also to discern whether or not this is something you're going to act on or whether you're going to seek a professional help. I think it's always better to rather see your doctor, see your ped, see the person who knows your child already and knows their story this far, because what happened in babyhood is going to influence now. So you want someone who kind of knows the full picture of your kid. Second to that, you know, so obviously we have our doctors who are involved in that, but we also have different allied therapists who are amazing when it comes to our relationship with food and our feeding and our nutrition and allergies and all these sorts of things. So, I mean, speech and feeding therapists are fantastic. Even lactation consultants, you know, the whole first year of life, when we're breast or bottle feeding, a lactation consultant can have a huge impact on the way your baby feeds and helping parents to learn about what's wrong and what's not wrong. Most of the lactation consultants nowadays are trained in assessing for things like oral ties, are trained in looking for things like infections in the mouth and that kind of a thing. So you can see a lactation consultant, a speech or feeding therapist, pediatric dietitians, I think can be very, very helpful, especially when we're in our weaning phase and for pickier eaters in toddlerhood, where we just want to try and encourage healthy relationships with food. A dietitian is really, really great there. So I think what's more important to do is actually just to seek the right help. As a starting point, most of the time your doctor would be able to assess for all the big, scary underlying pathological things and then send you along which route is the safest. I think also is to kind of back to it, remember the developmental stages and what is normal. So we don't always have to be worried. Sometimes it is actually just developmentally normal, and we want to kind of see that is this just a classic phase, or are they not eating because they're ill? Are they not eating as well because they're teething? You know, the way that our teeth come out is not very fun, so often kids don't want to eat when they're teething. So kind of assessing for, is there actually something that's wrong, and how long has this problem been going on for? If it's just a little short-lived thing, probably less concerning, but if it is ongoing, then it's definitely best to have it checked. When it comes to some of those bigger, scarier things like food allergies, for example, you want to see an allergy specialist there, because allergies can potentially be life-threatening. We can close our airway if we have a very severe allergy, so that's really important to assess properly and make sure that we know, are there multiple allergies, is there just one? And then obviously if it's things like reflux and constipation and all of that, you would want to get that sorted out with your doctor as soon as possible.
Jess, that's such sound guidance, so thank you for sharing that with us. I'd like to circle back to texture and variety, two things that you have already touched on. You've mentioned why these might be a little bit difficult at certain ages and stages to introduce, but can you talk a bit more about the importance of that and give us some practical tips on how we can include those for our kids?
Absolutely. And I think in the early days, we really want to make food fun because this is the foundation of developing a healthy relationship with food. So when we're talking about variety, we're not just talking about a variety of colors, which certainly we are. We're talking about a variety of flavors. We're talking about a variety of textures. We want to try and expose everything, but we also want your baby to have a variety of food experiences in the sense of their 5 senses. So we all know we're talking a lot about eating, so taste, but we also have our vision. So we don't just eat our food, right? We look at it, we feel it, we smell it. So you want your baby to get a full round sensory picture of their food. And that's why it's so important to let them play with their food and get messy. That's also why it's really important that your baby has that hand-eye coordination before we start. Because if they're picking up a piece of a veggie stick or whatever it may be and bringing it to their mouth, we want them to start playing on chewing on that little piece. And we don't have to have teeth to be able to chew. We absolutely can chew with our gums. And it's actually really, really important for the development of our jaws. We as a species, are devolving a little bit there. We're all getting really narrow faces, long, narrow mid-upper faces and jaws, which is why we have so many of us requiring orthodontics and expanding to get enough space for our teeth. It actually starts in babyhood, because if we can teach our babies to start chewing on things from an early age, that chewing and that pressure on the jaw bones is actually what stimulates the growth of our jaws. So getting that chewing from an early stage with textures and finger foods helps to expand those little jaws into a wide forward position, which allows for enough space for all of our teeth and so on to come in, while we're also desensitizing that gag reflex and getting our palate to mature. So it is really important to get variety of textures for that reason. I think often with introducing textures, parents will be really fearful around choking. And that's why nature is so clever and made us have a really strong gag reflex between 6 and 8 months to safeguard us from that. And I think it's really helpful for parents to learn the differences between choking and gagging. I quite like doing an approach of baby-led weaning and purees as a combination, because smooth is also a texture that we eat. Even as adults, we'll have some yogurt or some ice cream or something that's smooth, a soup. So we want to also be able to let them be good with purees, and purees is a nice way to blend different flavors together. But then gradually, as they tolerate, we can make it lumpier and more textured as we go, while they're also practicing with finger foods to get that growth happening. In terms of variety of foods, I think there's lots of lists like the 100 foods before 1 year old and so on. But I again always say to parents, just focus on introducing them as far as possible to the types of food that you eat. Not every family eats the same way or the same types of foods. So you want to expose them to as much of the normal stuff that you have in your fridge. So the fruits and the veggies and the meats and the eggs and the chicken and the fish and the grains and all the things that you eat, we want your baby to be exposed to. So I think variety of what the family eats is more important than variety of everything in the world. But also what's more important than variety of individual foods is quality of food. And I think sometimes we focus too much on the quantities and the varieties and not so much on the quality. So if we're providing nutrient-dense foods that we know have the correct fuel sources for our baby to grow and thrive, that's more important than having really varied diets. So I always say, mix up your plant foods, mix up your animal foods, have varieties of those. So, variety might look like on one day butternut and chicken, and on the next day might be butternut and fish. It's still varied, even if the butternut is stable. So it's okay to repeat foods as long as we're exposing to different combinations and different flavors and adding in different spices and different herbs. That also creates different variety and different flavors for our babies. But really trying to focus on, again, what the family food is and the flavors that you as a family cook with is important.
Jess, that again is so reassuring for parents, for myself as well. And I think also takes the pressure off of trying to fit ourselves into a certain box and doing things a specific way or keeping to a certain checklist, and actually just keeping it light and fun and varied, as you say. So Jess, we've touched on the one end of the spectrum where a child may have maybe not such a big variety in what they are wanting to eat. Can we talk about the other side of the spectrum, a child who maybe their parent perceives that they overeat or eat too much?
So, we sort of have a global issue of kids who are overfed but undernourished, meaning they're getting too many calories, but they're actually missing out on key essential nutrients. So I've actually seen many children who are kind of plotting above what we would expect or what we would like, but they are having micronutrient deficiencies. And this is unfortunately sort of the problem of 2025, where we are predominantly having too many processed foods. So, and that's why after age 2, because sort of under 24 months, we want, as far as possible, no refined sugar because of the increased risk of metabolic disease and all the long-term effects thereof. But after 24 months, we need to be moderate about it. So I always say to parents, it's not about never letting your kid have some chips or chocolates or sweets, but we really want to try and do an 80-20 rule. Less than 20% of their diet should be processed foods, because when we kind of replace their appetite with nutrient-low foods, they're not getting the key essential nutrients that they need because they've filled up on sort of these empty calories. So the way in which that happens is it kind of becomes a vicious cycle as well, because the more we eat those processed foods, the more we're feeding our opportunistic bacteria in our guts, and who we feed is who thrives. So if we're feeding the bad guys in the gut, the good guys are going to be suppressed, which means that we are going to shift in our cravings. So the way we kind of decide on what foods we want actually is an internal drive that is triggered by our microbiome. It kind of demands what it wants. So when we have more opportunistic bacteria in the gut, or even funguses in the gut, they trigger us to crave certain things. And it's usually, unfortunately, our sugars and our processed foods. So we have to then sort of think, what is your child's gut health doing, as a kind of cornerstone to that? But secondly, is our child using food as a psychological soother? We, as many adults, do that as well. So we want to know, is your child or your toddler using it to kind of soothe an underlying anxiety or that kind of a thing? So you want to look for things like that. But then, of course, you also want to know, are you actually giving your kid enough satiating foods, or are they genuinely hungry and they're seeking nutrients? Most children have a very strong sense of hunger and fullness, and so they won't eat, as we all know, they won't eat if they're not hungry. But on the other side as well, if they're eating, they're actually seeking out nutrients. So if we're only giving low nutrient foods, they're going to be insatiable, as we say. So when we're talking about satiating foods, we're talking about our protein, we're talking about healthy fats, and we're talking about fiber. And I think it's helpful sort of to assess this with the way your child grows, because we can calculate these things. We want their protein intake to be a minimum of 1 gram per kilogram per day, up to about 1.2 grams per kilo per day. And then their fiber, kind of use their age in years plus 10. So if you're 5 years old, you need 15 grams of fiber per day. And those are things that we can kind of track and see through the diet. Are we actually getting enough of these foods that fill us up, but are also nutrient dense and giving your kid the essential nutrients that they need? And then other things, we have to assess, is something stealing our nutrients from us? And this is pretty common, right? Kids get worms. We can have parasites in the tummy, which steal all those nutrients from us and make us a little bit more hungry. So, and that's an easy thing to correct.
That's so helpful, Jess. I would love to move on to some practical tips. And I'm thinking about the lunch boxes that I'm going to go home and make just now. And I would just love to get your take on some ways that we can start to include more texture and variety in a healthy way for our kids. What advice do you have for us?
Yeah, so I think the lunchbox is such a great sort of, for me, I'm a very visual person, and I like to sort of envision the lunchbox. We've got nice lunchboxes in South Africa that have those little divisions, and they've got the little pictures of a little fruit and a vegetable, and et cetera, et cetera. But to sort of look at it as a full meal. We want to look at our lunchbox as this is a full meal. And for me, we want as far as possible to try and get 5 things in every meal. This isn't always completely doable with kids, but we try our best, right? Remembering, again, our division of responsibility. So it's our responsibility to offer and expose, and it's their choice if they're going to eat it or not, right? So obviously within that lunchbox, you want to always have a safe food, something that you know your child will eat, but also start challenging them and putting in something there that might be new and exciting that they might try. And if they don't, it's also okay. So those sort of 5 things that I try aim for in every meal, including in the lunchbox. We always want to have a good protein source. So a complete protein, whether that's an animal or plant protein, but something with all essential amino acids. We want to have some fat. So some healthy fats could be, we're trying our best to get omega-3s, but any kind of healthy fat. So that could be, some nuts and some seeds. It could be some avo. It could be some olives. Olives are nice because they double up also with ferments. So I always try and get something fermented into that. A common one for kids that's usually an easy one to accept is some yogurt. So a little bit of whole fat yogurt in there is a great option for a fermentable thing. And again, because that's feeding the right bacteria in our guts. So we've got our protein, our fats, our ferment, then fiber. So a good version of fiber, which means a whole fruit or maybe some cut up veggies, that kind of a thing. Could be a whole grain little bar or something that's high in fiber. It could be some kind of a little sandwich that's got a whole grain bread, something that's got high fiber. And then the last thing is a polyphenols. So polyphenols, we kind of think color. So we want something that's a nice, bright, bold color. So berries are great for things like that. And that's what's cleaning up our DNA. So if we've got all 5 things, we are, with our protein, our fats, and our fiber, we are satiating our kids and we're giving them high nutrient density. The fats particularly, we're giving them brain power for the day, which we obviously want for them for their school day. And then with our ferments and our polyphenols, we're cleaning up our systems. So I kind of like thinking of those 5 categories when we're building a lunchbox. And it really, with lunchboxes, they don't have to be wildly exciting every day. They can be repetitive. It doesn't have to be, this completely new and exciting thing every day. It can be repetitive, and that's okay. For me, I kind of have like maybe 3 or 4 different proteins that I cycle and 3 and 4 different fats that I cycle and so on. But then the yogurt is kind of a staple and it's always there. So it doesn't always have to be completely varied. And I think that again is we put so much pressure on ourselves with these lunchbox ideas. With lunchboxes, a really nice thing to always add, especially for our younger kids, is something crunchy. So this is actually from an OT perspective. We spoke briefly on our 5 senses, our external senses, but we have 2 internal sensory systems as well, our proprioception and our vestibular system. And those are the 2 that we work on with OT. And often if your kid is tired, they've been they've had a busy day at school and they're a little bit more emotionally dysregulated, a crunchy snack is actually a really great regulatory tool. So some cut up raw veggies or some nuts or something that's crunchy is a really nice thing for them to eat to help regulate that little nervous system. So I always try and add a crunchy snack in there too. But it really doesn't have to be completely busy and over crazy. So practically I always say to parents, try and see that whole lunchbox is a full meal. Same thing with snacks. Some kids prefer to be snackers over eating large meals through the day. And that's okay if it fits in with your lifestyle. But then if you were to put all of those snacks on one plate, would it comprise of a full meal? And would it be getting all of our categories? What we often tend to do is we have too many snacks that are carbohydrate rich, and then we're missing opportunities for nutrient density. Practically, I would say probably the most important thing, and we all know this concept that breakfast is the most important meal. Not true for everyone, but definitely true for children. We expect a lot of kids, they're going through busy days, school is busy, extramurals after school, sitting and concentrating and focusing, growing brain connections all through the day at school. We need to make sure we're fueling them properly. So breakfast really is important. And I think from a convenience perspective there, we often fall short because we just do a quick cereal and so on, and we're not getting fats and proteins. And we really want to try to get fats, proteins, and preferably fiber in that morning time meal, because that kind of sets them up for the day. When we're having high sugary foods or high processed foods, especially early in the day, they're just going on a roller coaster through the day of sugar spikes and dips. When we're introducing fiber, fats, and proteins at breakfast, we can have a nice satiated, long, slow, steady level of energy through the day. So I always say to parents, think of feeding your kids like kings in the morning, like queens at lunchtime, and like paupers in the evening. It doesn't matter if they don't want to eat dinner, if they had a good lunch and a good breakfast. I think it also kind of takes the pressure off planning 3 meals a day. It doesn't have to be as big at nighttime. Let that be more about the social interaction of feeding. And then part of the practicality, I would say, of nurturing just this healthy relationship with food is really just always remembering that we are modeling We're modeling to our kids, and we want them to be seeing the way that we eat food, and for that they need opportunities to eat together. So they need to eat with us. We need to try and fit our schedules in a way that we can eat at least one meal a day with our children. And I always say to parents, it doesn't matter about where your kid, sometimes we get too fixed in the wrong things. Although we decide where and when and what, if your kid decides that they want to sit on your lap at the table instead of on their chair, that's okay. Be flexible. If they decide that they want to camp underneath the table and eat there, that's also okay. Let them eat there. We don't want them to obviously run around and be all crazy, but let them be flexible with that. It's okay for them to want to also still be children. And letting the feeding space be playful also creates a sense of safety for kids. So they'll be much more interested. From a practical perspective, we also really want our kids to be involved in buying the food, prepping the food, dishing out the food on the table. Let them get involved. Kids are much more eager to be interested and much more eager to comply when they're part of the process. So get them involved in these things is really fun. It can be a nice, fun sort of opportunity for play. Kids are learning through play all the time, and play can look like mixing things in a pot and stirring and so on. So getting them involved as much as possible is really nice. On the contrary to that, what we really don't want to do is have distracted feeding. We really don't want to utilize screens with feeding, and that's a big issue in 2025, where a lot of, especially of toddlers, when they go through those normal developmental stages of not wanting to eat, and then parents kind of are force feeding them while they're watching a screen. It's short-term reprieve for long-term downfall. It's just not helpful in the long term. What our children actually learn there is to disconnect their internal senses of fullness and hunger, because they're completely unaware of what they're eating and they're distracted. So we really want to have them being involved and being aware of what they're eating, not being force-fed ever, and certainly not with screens and big distractions.
Jess, I think your take is so flexible and practical, being a parent yourself. And I love your 5 touch points to just think about in terms of what we can include, especially from a lunchbox perspective. I will often tell patients that I see as adults, but it goes for kids as well, is to try and eat the rainbow in fruit and veg in a week. And you can gamify that and again make it more fun, and that makes it more tangible for kids to get involved. When we talk about being convenient and practical, I'm also thinking about parents that might want to use supplements or probiotics and those kinds of things that are maybe supplementary to a diet. What is your take on those?
Yeah, so exactly as you said, Trace, those should be supplementing a good diet. We certainly don't want to have supplements and probiotics and all of these as sort of the cornerstone of our nutrition, and then we're just eating a bunch of processed foods on the side. So I'm definitely a fan of supplementing appropriately. I think oftentimes we over-supplement when we're doing it blindly, and sort of things. I'm not a big fan, for example, of multivitamin syrups and stuff for kids, because they tend to be teeny tiny amounts of everything, which is actually not very helpful for most kids. Whereas what's far more helpful is to supplement the right amount of the things that we know are low in your particular child. So I do think supplementing needs to be individualized. And also quality is important, because not all supplements are created equally. And because we don't have third-party testing on all sorts of supplements, it can actually be tricky. So you might think you're giving your child enough of something, and actually it's not a very good quality or a bioavailable form of a nutrient. When we're talking about bioavailability of nutrients, food sources are always ideal. So we will always get more quality and quantity of nutrients or vitamins and minerals through our food sources, because they're coming with it the appropriate cofactors that come for helping absorbing those nutrients into our guts appropriately, and also in the right amounts. When we're supplementing blindly, we can over-supplement things, and then that's obviously not helpful. So I do like supplementing, but I think it needs to be catered to every individual child, and is often sort of a bridge. We can use it as a bridge while we are building up their appetite for nutrient-dense foods, and getting them to a place of being able to take over the nutrient requirements with just food. From the probiotic perspective, again, quality matters. So probiotics can be great, but are they actually even reaching the level of your child's colon? So many, especially our sort of more dehydrated probiotics, when they enter our stomach, the hydrochloric acid in our stomach, if we're rehydrating with acid, we're killing that bacteria and they're not even going to reach the intestines down below. So probiotics are helpful if they're a good quality, so how it comes is important. But then again, far more greater sort of impact from getting it from food sources. So getting pre and probiotics through food, so our fermentable foods, our fibers that go down and actually feed that microbiome, and then the microbiome can thrive. Much easier and much more effective than just blindly giving probiotics consistently.
I think that's helpful. I mean, to summarize that, you're basically saying that our diet is primary, and supplementation should be appropriate and potentially guided by a healthcare professional who has deemed it appropriate in a specific individual child's case, right? Yep. Jess, we've spoken so much about empowering parents with knowledge around food, but because we know that we do empower with knowledge, how can we talk to our kids about food so that we can give them that knowledge and hopefully set them up for a healthy relationship that way?
I love this question, Tracy, because actually so often in consultation, I'm kind of teaching the parents secondarily while I'm talking to the kid, because we never are going to get our children to do what we want them to do if they are not understanding and curious about it. Our kids need to understand why we're doing things. So a great way to talk about food, and I think you can start doing this from really early on, from 2.5, 3 years old, you can start explaining to your kids about plants are cleaning your body, animal foods are building your body, whole grains are for fibers. We start teaching them like that. And as they get older and older, you can obviously add on to that. So, you know, my daughter's 5 now, and she knows that when she eats fish, she'll say things like, oh, fish is really good for my brain. My brain really likes things in fish. Or she'll say, this steak is going into my muscles and it's going to make me strong. So she'll talk about food in that way. And I think teaching our kids with those types of language and those sort of types of conversations is really important, because if you teach your child what that food is actually doing in their body, they're going to be more curious and interested about it and more willing to try. When it comes to kids who are sort of not as willing to eat a variety of foods, talking to them is how you get them on board. I had this lovely little patient, she was 8 years old, and when I first met her, she had terrible eczema. Very sort of atopic child through the course of her little life, but also very difficult feeding journey. She only ate 4 foods, literally 4 foods that were all beige. And she obviously had a lot of micronutrient deficiencies. So while we were working on those and supplementing them appropriately, we started doing what I call the 1 food per week method, where she got to choose a new food each week that she was willing to just try. And all we have to do is have 1 bite of that food once a day for the week. And at the end of the week, she gets to decide if she's going to keep it or not. But before we choose the food, we talk about, so she'll kind of give options, and then I'll say, all right, you've chosen these 3 foods. Let's talk about what's in that food and what it's going to do for your body. So it's not helpful to demonize foods. I don't like saying, oh, sugar's really bad for your body. So I'll tell kids sugar's for fun, but it doesn't give you the fuel that your body needs to grow and thrive. So we can have that, but what about giving us something that's got a bit of protein in it, or a bit of fiber, or a bit of fruits and veggies, whatever. But talking to them about it, because that's how we actually get them on board. So it's really important to let your kids understand what the food is doing to their body. And this is so age appropriate. I mean, you can start off with saying, fibrous foods feed the bugs in your tummy. And as they get older and have more understanding, you can say the bugs in your tummy are called your microbiome, and they really like these kinds of foods. They really like fibers and plants. Why is this important? When the bugs in your tummy are happy and healthy, they make you feel happy and healthy. So you can build on those conversations as they age, and it really just empowers the kids to feel more involved. That little 8-year-old now eats, I think she's on 17 foods now, which is really cool. And she's chosen all of them. Of the 17, she's accepted 15. There were 2 that she said were a hard no, carrots were 1. But that's also okay. And she's been willing to try other things.
That's amazing, because there was also a sense of autonomy for her in that whole thing. It wasn't a forced decision. And so she still has a healthy relationship with food, which is fantastic.
Exactly.
Jess, there are so many things that we have to get right as parents, or should I say we feel we have to get right as parents. And I'm thinking of myself, but for other parents too, What if we feel like it's too late? Is it ever too late to try and foster a healthy relationship to food for our kids?
Definitely not, Tracy. I mean, even as an adult, as a parent, if your relationship with food is not great, there is always time for repair. I think that's the beautiful thing about the human body, is that it can heal. And we can shift and we can change. And although our microbiome might be more set at a certain point, we can absolutely manipulate and adapt that. So it's never, never, never too late. And I think the longer we go on with feeding issues, the more it becomes about looking at the person holistically, whether that is a 7-year-old or an 8-year-old or a teenager or an adult, to think, okay, it's not actually just about the food here. What's the psychological relationship here that's affecting it? And that's why we kind of want to target it from both areas. Oftentimes, if we have micronutrient deficiencies, that also affects our appetite, it affects our mood, and that will compound. So you need to look at the full picture always, but it is never, never, never too late. All of these things are completely repairable at any stage, at any age.
Jess, thank you so much for taking the pressure off us as parents and giving us practical tools. It's been such a wonderfully rich discussion, and I've loved how you shared both your clinical experience as a doctor, but with the practical lens of being a parent. To parents that have joined us today, we hope that you found this really insightful and valuable information, and that you can understand just how important it is to try and nurture a healthy relationship to food for our kids, and that it is definitely never too late. Until next time, thank you for joining us. Keep living a healthier and fuller life for you and your family.